This is Christina with Questions for a Nurse. And again, I'm reading funny nursing stories off of a site called ShiftMed. So this one said, we all gathered around the bed of a patient having a grand mal seizure, watching her arms and legs shaking uncontrollably. Except there were whispers that maybe she was faking it. I reached over and gently tugged the pillow out from under her head. She quickly reached out with her hand, grabbed it, and tucked it back under her head and kept seizing. Busted. So I can't ever recommend this as a method for any nurse to do, or a family member, anybody, to try and prove that somebody is not having a real seizure. And I have had patients who fake seizures because they can get Ativan and longer stays in the hospital. So it's not necessarily uncommon. And I don't want to take away from those who actually do have seizures. That's a horrible condition to be stuck with for your life, and the meds can be tough. So, but it is not an uncommon thing. I would say I've had multiple patients that fake seizures, and we've had to try and figure out how to disprove them, because it's when you hook something up to their head to try and diagnose the seizure, magically they don't have a seizure that time. One doctor I remember, she'd had so many seizures as patients. She had seizure after seizure. So he came in, he hooked these EEG machines to test the seizures, and he left them on for like a week to see if she was really having them. And after a week of no seizures, after having tons of seizures, even off of all of her meds, he determined they were fake. But it was pretty funny.